Erin Kent. I am an associate professor and the associate chair for research for health policy and management in the Gilling School of Global Public Health at UNC. So I think what's really drawn me to study caregiving goes back quite a ways. I don't think that I had the language around caregiving when I was in college and graduate school and even beyond. I knew that I was very interested in the impact of serious illness on not just the individual experiencing the illness, but their family and their friend network. So I was interested in social support and interested in how we can kind of strengthen supports for people, not just the individual, but their surroundings. But I didn't really call that caregiving until I went to the National Cancer Institute for my postdoc. And at that same time, I became a parent for the first time. And I had, by all accounts, a very sort of typical and like normal pregnancy in terms of health concerns for both myself and my daughter. But I was thrown into parenting, and I was thrown into parenting after moving across the country and away from really any supports. I certainly had my spouse, who was wonderful. He was also in the military, so we deployed for part of the time. That all of a sudden encountered what it's like to feel alone and very, very responsible for someone who is very vulnerable while I was studying serious illness. And something just really clicked in me that we don't think about, we have this incredibly advanced, sophisticated modern society with all of these options, and yet we've become in so many different ways, I think, divorced from the supports, from providing the supports where people really need it. And so I think for me, like really studying caregiving, because caregiving often happens out of kind of two sides of the same coin, love and obligation. And when it happens, it doesn't usually feel like a choice, even if people would do anything for their loved one, right? It's just, of course, this is what they're going to do because this is important and this is necessary. And the trade-offs that often happen in that case can be really profound for people, from certainly a mental health perspective, sometimes a physical strain perspective, an economic perspective, an employment perspective, and yet most people will have either need or be a caregiver in their life. So I think becoming all of that together is what really drove me to want to study it more formally and have it be a big part of my career. A caregiver is someone who is providing significant support to another person who has either a serious health problem, a disability, or illness. And then I usually say things like over an extended period of time, and that it requires some degree of intensity. And it depends on the context if we have to put thresholds in, like a certain number of hours per week or duration of time, because it's very different if you're tending to someone who's recovering, say, from a surgery or a very acute illness and it's only lasting a week or two. I mean, that's intense and that's important. But what we're really focusing on in caregiving are situations that kind of go on for a pretty long period of time, right? More than a month, maybe more than 2 months even, and that are starting to have an impact on the other areas of the caregiver's life. So their own employment, if they're in school, their schooling, their ability to take care of children in the house, their ability to sort of engage in their own social activities and things like that. So yeah, that's how I think about caregiving. And I definitely would distinguish it from parenting. Parents can also be caregivers if their children have a serious health problem that requires a more of an intensity than you would expect from typical parenting.
Are there any distinction around like paid and unpaid, or I've also seen kind of formal and
great question. So the distinctions around paid and unpaid. So we've, as a field, we've sort of moved away from the term informal because so much of the tasks that many caregivers are providing are essentially healthcare delivery tasks. And so that term informal gets a little, it doesn't quite convey that. And then the paid versus unpaid piece is also tricky because most family caregivers are not paid, right? But there are some programs that they can receive that some caregivers can apply to receive some stipends around. So there's a program through Medicaid. There's also a military program through the Veterans Administration that actually helps provide stipends and support and training to caregivers of eligible veterans. But these are still pretty, I would say, like, it's not the typical experience for most caregivers. It's just that there are some caregivers who have been able to get some compensation or some degree of funds, not a lot, but for their work. So and those individuals are still very much family caregivers. They just might be getting a little bit of compensation. I mean, there's lots of different policies that have been considered or are currently being considered to help with the financial costs of caregiving. For example, tax credits for caregivers, or paid leave policies for caregivers who need to step away from work but don't want to lose their jobs and also need to maintain some income. So there are some policies that either have been enacted to a certain extent or are still being considered at various state and national levels. So I sort of have two different sides of my research related to caregiving, and one is trying to develop and adapt and implement interventions to help support caregivers for someone going through a serious illness. So right now we have an intervention called Encompass, which is a supportive care intervention designed to help caregivers of patients going through cancer treatment. That involves a one-on-one coach, series of coaching sessions to help build problem-solving skills, help kind of build support-seeking skills to help widen the network of supporters, as well as connect caregivers to formal resources. So we have that. We've in various stages of pilot testing. We're building a multi-site study between UNC, Moffitt Cancer Center, and University of Vermont, with a focus on two different populations, both so all within the cancer space, but we're on one of our studies is looking specifically at patients who have cancer and diabetes to sort of look at the what it's like to help support people going through sort of multimorbidity, having more than one chronic condition. And then on the other side, we're focused on looking at patients who live in rural areas and or are having to travel far for their cancer treatment, because we think that presents a unique set of challenges for families seeking care. So they may have to, be in radiation treatments daily for, multiple weeks. And so then the caregiver may be managing a lot in terms of additional household work, childcare responsibilities, and may or may not have the kind of supports they need to get through all that. So we're working with both of those populations, and we're continuing to gear up for a randomized controlled trial of that intervention.
Who, in the research that you're doing now, who are you kind of noticing are typical caregivers in the space of serious illness?
Great question. So I would say it's about half spouses or partners, because we are focused on adults with cancer. But that's only half, right? So we see a lot of adult children of someone going through cancer. So so like adult offspring, if you will, daughters and sons. We also see siblings. We also see friends. We also see different kinds of relative relationships, because it's not one size fits all. There is a lot of work focused on couples going through serious illness, and that is a particular kind of relationship that has unique issues that they go through. And we see that in our study as well. But a lot of the sort of tangible support issues, like how are we going to make all of these things happen in a way that is protective of the patient going through cancer, so they don't have to worry about who's going to pick up the kids from school, who's going to make sure all the utility bills are paid, how am I going to get to all of these treatment appointments when they may be very fatigued, having other kinds of side effects from their treatment, and really just need to rest. So we're trying to figure out ways that we can extend the support, essentially. I'll just say that I really like to think, and it doesn't work for every family, doesn't work for every situation, but one strategy that I've seen families use, and they may not use this word, is deputizing. So like if the primary caregiver is able to deputize either one or more people to help with various support aspects as they're going through this acute serious illness time, then it can kind of help extend the support in different ways and not put too much burden on one person to sort of make everything work. Oh, so what's the case for why we need to do this kind of work and support caregivers is such an important question, because we need to continue to provide the value proposition for supporting a group of individuals who are very care adjacent in the healthcare delivery system, right? Like there are some systems who will record the identity of a caregiver, and there's actually a policy around that many states, North Carolina not being one of them, that have passed that actually helps hospitals record the identity of a caregiver, but many don't. And so so they're care adjacent, meaning that they're clearly a presence in that whole treatment process and that sort of those care delivery encounters, but there's no way to really track them. You know, it's unclear how much support or intervention can be formally provided to them since they're not the patient themselves. That said, they're part of the care team as well, right? So if the patient needs to have a series of things done so that they stay healthy or they get the treatment they need, oftentimes activating that caregiver is going to be really important. They're going to be helping that patient if they're hospitalized, discharged to home. They're going to maybe be providing some of the medication regimen that they need at home. That patient may need help with activities of daily living, and that caregiver is going to likely then be relied upon to do all of those things. And so to me, the value proposition is if you support that caregiver, you give them the preparation, the training, any assessments, if you help manage any of their potential issues related to, say, burnout or related to distress, you're likely going to help create or help maintain the health of that person who's going to be the direct supporter of that patient. So so measuring that is really important, and finding ways to kind of document that, hey, if you provide these supports, here's kind of the payoff in terms of better health outcomes for the patient, and frankly, better savings for the healthcare system. You may be forestalling emergency department visits. You may be reducing readmissions or shortening length of stays. So those are all things that both patients, their families, and the health system care about. So thinking about what are some things in the policy space in North Carolina that are happening right now that might help support caregivers. Well, I think the most exciting thing that I can think about is the fact that North Carolina recently launched its multi-sector plan for aging. It's called All Ages, All Stages. And it's supposed to be about a 10-year plan to bring together different sectors, health, social sectors, commerce, all of these different sectors to really think about helping North Carolinians live longer, better lives, right? We're like many other states, we're an aging state. We're experiencing a growth in our older adult population, ages 65 and over, and also 85 and over is really the big boom. And so we have to be thinking about planning for aging in all of these different ways. Well, part of that is around supports for caregivers. In fact, one of the 4 main domains of that plan is supporting older adults and their families. And within that, there's a whole subcommittee dedicated to supporting caregivers. And I can say that one of the initial goals is to continue support for something called the Caregiver Portal, which is it's a North Carolina specific portal or website, essentially, that anyone who identifies as a caregiver can register for. It's free of charge. And it provides all of this information about caregiving. It has videos about different ways that you can, different tasks related to caregiving. For example, like I mentioned activities of daily living earlier. So there's videos about how to do that effectively for different care recipients. But there's also a lot of support. So They have online support groups for caregivers, of different types of caregivers. There's contact information for the National Family Caregiver Support Program for the region that caregiver might be residing in. So there's a lot of really great information out there. So it's exciting that the portal exists and it's continuing to be refined, but it was originally supported through some of the funds that came out of the COVID pandemic. So we're trying to see if its support will be continued, and then also to more effectively use it. So can the word get out to more caregivers so that they use it? So that's kind of a really tangible North Carolina specific program that I think has a lot of potential. So in terms of new or really important topics in caregiving that should be studied, or that we hope that more people should be studying, especially sort of, students coming into higher education. I think one of the biggest things is just the ubiquity, or the how common caregiving is. So there's a national strategy now in place to support family caregivers. It was put into place with some legislation called the RAISE Act in 2018. And there's 5 goals related to the RAISE Act. This is a national, not just North Carolina, but a national policy. And the first goal of RAISE is to increase awareness about caregiving. And I'm so glad they made it one of the top level goals, because and I'm speaking from personal experience, but I think many people don't even really think about it or know that term until they're thrust into the role, right? So it comes as a big surprise and a shock for people when they all of a sudden might be in a situation where they're having to be a primary caregiver for kind of around the clock for someone who is having a serious health problem. And so I wish we had better awareness kind of across the pipeline of education, like going back into youth, because in terms of like things that are understudied, one of the biggest topics that is understudied in caregiving is our youth caregivers, are minors, people who are under the age of 18, and are really providing what would be equivalent to primary caregiving tasks for a member of their family or member of their household. And nobody really knows about it, right? Because it's sort of either thought to be implicit, or just they're kind of, maybe there's no one else to do it, or they're having to share the load, or maybe there's even some fear that there would be some negative consequences if people sort of knew that child or that teen was caregiving. And so there's a lot not known about youth caregivers. So I wish, number one, we had more awareness about caregiving across the population, that people, even if they don't love the term, would at least be able to kind of identify as somebody who is caregiving, if they don't like the even term, like I'm a caregiver, so that we could get more of a sense of who's doing it, what are they doing, and what kind of supports they need. So just, I think more awareness would be a big one, and then really a focus on youth caregivers. Like, no one should have to be alone or isolated in their caregiving. There are a lot of resources out there, and it can be overwhelming. But to just know that there are resources out there, that if you use the term caregiver, you might either with like a navigator or a support person or a healthcare professional, you might actually get connected to more resources than you might know about. But there are a lot of really well vetted resources out there, and UNC has a number of different places to go on our websites, and that provide information for caregivers. So you're not alone. That's what I like to tell people, that there's lots of people doing this work, and there is support out